This is Mr. M. Ogwang Omuga is in the house. You can join us at Metropole TV KE live on YouTube as well at Metropole TV KE. Now, Richie, give us the start of our show this morning.
Nurses, clinical officers, medical lab technicians, pharmacy technicians, nutritionists, and other cadres of health professionals are set to down their tools from Monday to demand for better workplace protective equipment. This is coming in the wake of the outbreak of COVID-19 in the country and 2 weeks since their trade unions issued a strike notice.
On the 17th, actually midnight. So on the 18th, there will be no services. And this is a notice now to the public that if you don't see us here again to tell you otherwise, don't go to any public hospital.
Kenya Union of Clinical Officers General Secretary George Gibore has further accused the government of failing to conduct mass testing of health workers, claiming that 97% of their members are yet to be tested.
You hear them saying that the hoteliers must be tested. I want to believe that this is targeting all the people who are working in the public, or rather social places, including the hospital. Now, if those people must be tested, and you yourself, the focus on the healthcare workers has not happened, why use the double standard?
The union leaders also lament that some health workers in Kirinyaga, Vihiga, Migori, and other counties have not received salaries for the last 2 months.
We are trying to say that you cannot continue to afflict pain on health workers who are already experiencing a lot of pain. They have been highlighted here, how our people are suffering without training and without PPEs. And again, when you deny them salary and a number of them are buying masks for themselves, it is total torture to the healthcare workers.
This is along with harassment of health workers by police officers during curfew hours. The leaders, however, say they are open for negotiations with the Ministry of Health before Monday on these issues.
It's power. Power.
For Metropole TV, I'm Nancy Marende.
Thank you very much, Nancy Marende, for that report. It is a wow. Ogwang. Yeah. So now the ice is cracking, isn't it?
Sure, it is.
That we're talking about a number that is not reducing anytime soon in the country. But then at the back end of that, the health professionals, they're going on strike as from Monday. And we haven't seen any reaction. I mean, they met that threat last week. Nothing has been done in between. This is the second update, and now they're saying, if we don't see them come back, that means you and I should not make a mistake of going to hospital because the nurses won't be there.
On a lighter note,
yes,
that one actually makes traditional medicine people very productive. So after Wednesday, you should see your traditional doctor. but
on a lighter note,
this government is showing time and time again that it's a joke. The government is found wanting in prioritization. These guys have been receiving money every day from well-wishers to donors. The other day I saw Kalonzo give them 3 million.
Yes.
Where do they take all this money? If we cannot actually prioritize with the people who are at the first front, the line at the top, these are the professional healthcare givers, the nurses, the doctors. The guy is actually making a very legitimate point that if you want to be tested and you want to be tested by a nurse or a doctor, shouldn't we first of a priority ensure that nurses and doctors first get tested?
Yes.
Could actually that be the reason why these numbers are actually going up? Because the people that are testing us, could they be contaminated?
And there was that report,
yes,
34 nurses already infected by COVID-19.
And I'm telling you, and I don't want to sound bad. I don't want to sound bad. But the challenge is government is a joke. the way the government is going about this entire COVID situation, it's actually a joke. If you want to take care of the right things first, then it's important, first of all, can we get it right with the medical practitioners?
Yes.
Can we ensure that the medical practitioners get their pay?
Yes.
The other day, actually it was last week on Friday when we were having this conversation, and we said that actually World Bank has actually given Kenya 7 billion. For heaven's sake, where do they take all this money? We buy our own masks. We buy, when people go to quarantine, they pay for themselves. Nothing has been done. There's no hospital that they can say, we have put up this hospital in this span of 2 months with this money.
Yes.
Where are they taking this money? Nurses don't even have salaries. They have not been paid for 2 months now. And I'm trying to imagine this is countrywide. That's a joke. Someone is playing. It's either, like Chief Justice said, the former Chief Justice says, this is an economy of bandits. And every single opportunity we get, we can rob and steal. The challenge here is either we lack priority or this money is ending up in private pockets. And that's the greatest tragedy that we have. In this time, if people had conscience, if you want to steal, hawezi ngoja tuanze kuiba kama tumeshamalizana na COVID. Must you steal even now? We are fighting COVID, we are fighting you. At the end of the day, this is a losing battle. And that's why actually the CS for it's a very negative indictment on his part, on his competence to actually manage the health docket. Yes, Simba.
Just want to leave it there, because Monday will come and then we see exactly the way this story has developed. Other than that, let's move on to another issue that we want to look at this morning. Now, Airtel, Kenya's parent company, Airtel Africa, indicated in a briefing Wednesday it would not change its aggressive pricing practices that have seen it charge lower prices on both data and voice compared to its rivals. CA data now shows that the telco's share of Kenya's voice traffic stood at 29.2% in the 3 months to December, compared to Safaricom's 67.1%. Airtel has always factored its growth on a low-cost pricing strategy to grow its voice traffic share from 12.1% in March 2017. Now, this is quote, in Kenya, where we are a smaller player, our prices will continue to be a lot more aggressive than those of the leader, and we will try to keep that difference going forward, said Africa Managing Director, that is Raghunath Mandava, on Wednesday. Now, can this strategy therefore work for Airtel in the long term? How will the merger will Telkom boost its market share, and with the balloon internet deal with Loan LLC, help Airtel bite back Safaricom's dominance in the market? That's the question. Talk to me.
Yes, Simba.
Airtel has been on a lower pricing model for quite some time now.
Okay.
But it doesn't look like that is turning around the fortunes of Airtel in the Kenyan space. Now, the director is saying that we are not going to change. That is going to be our long-term strategy. Do you think that at some point, if they stick to it, then people will turn around and say, wow, there is a cheaper option?
And this is the problem, especially with the African marketplace. I've tried to really try to understand, why is it that Airtel has never peaked?
Yes.
The challenge with entrepreneurship, and I'm an entrepreneur myself,
yes,
the challenge with people who are at the marketplace is how to have real estate in the mind of your consumer. And the way you position yourself, the way you distinguish yourself, will either put you in good biases of the consumer or the worst bias of the consumer. Because it's me as a consumer that I will say, no, the way these people are trying to position themselves,
yes,
I think these are the people to conduct that I can do business with. So let me ask you, maybe the definition on aggression has changed. How is Airtel pricing model aggression, or how are they aggressive by their pricing policy. These people are charging nothing. That's not even aggression. So let me ask you, you're doing business. I'm an entrepreneur.
Yes.
And in entrepreneurship, I don't trust anything someone gives me for free. There is nowhere you can give someone something for free, not unless you're poor. Even when you're poor, you still have biases. Why are you giving me your services for free? These gentlemen are equally transacting, sending you money for free. Have you ever, do you even own their airtime, their airtime, their SIM line?
Well, I don't.
I don't. The other day, actually yesterday evening,
yes,
someone called me thrice. So the fourth time I picked, when I was looking at the prefix, I was like, these are a school leaver. You know, these are school leaver. If you want, and that's the biggest point that
yes,
Airtel has never gotten right.
Yes.
How to position their brand, their products, and their services in the minds of people who have consuming power. Mm-hmm. The challenge here is Airtel is positioning itself in the minds of people that do not have expenditure power.
Yes.
So if you sell your airtime and you sell your line to my small Cs, who is unemployed? Right? Will they sustain your business? And that's why I'm saying that the challenge, I think I have to be educated. What does aggressive mean? Aggressive would mean that if their competitor, their main competitor is charging 2 shillings, then let's charge 3 shillings. That means we are aggressive. But if your competitor is charging 4 shillings per minute and you are charging 0, is that aggression? That is not aggression. So the challenge here is, are we positioning ourselves in minds that are not sustainable, that we cannot actually sustain our business prospects? The challenge with entrepreneurship is, how then do you position yourself in the minds with the people with money to spend on your products and your services?
Yes.
And that's why their competitor is actually not even scared. Because the competitor is actually the one who should actually, if the competitor is charging 4 shillings per minute, right? And the person is not even scared that you guys are not even charging anything, shouldn't that worry you? The approach that Airtel is making, and I don't speak for them, yes, I don't know what informs their business policies, I don't know what informs their pricing policy, but from a person who is actually engaged at the marketplace, the first place that every entrepreneur gets it wrong is with pricing. Because if you charge what you're serving, if you charge your service, let me say, if I come to you for a service and you charge me 500 shillings, mm-hmm, and someone equally charges me for the same service 10,000 shillings,
yes,
whom will I go to? The mindset at the marketplace is the person who charges more because they are competent. Mm-hmm. The person who charges less because they are incompetent,
yes,
and they lack capacity.
Yes. All right, just briefly, therefore, before we go on to the next issue this morning,
yes,
Ogwang, now we do know that the next frontier probably in the Kenyan market could be on data services.
Yes.
Now, we did know there is a merger between Telkom and Airtel.
Yes.
And Telkom just did score a deal with Loon LLC just for balloon internet, expand their 4G network coverage.
Yes.
Do you think that could be the place where this Telkom and Airtel are pretty much going to bite the dominance of Safaricom?
No. What will they be using? The most reliable form of connectivity is fiber.
Yes.
And Safaricom has laid fiber all over Kenya. So as at now, Safaricom is not even scared. You can not even carry it in a balloon. You can even have it in mugs and send it to people's homes. And people will still not buy it. Why? Because Safaricom got it right. The most reliable internet connectivity anywhere on the globe is fiber. Mm-hmm. And Safaricom laid the fiber optic cables. You know, so even to that extent alone, Airtel is coming from a point of disadvantage.
Yes.
The disadvantage here is, at some point, if they will need to route that connectivity, they will still need to route it through Safaricom fiber optic cables.
Pretty much. All right, let's move on to the next issue this morning. Now, even as the government eased the restrictions for the reopening of the restaurants in Kenya, a spot check in Nairobi indicates, or it shows, that most of the eateries are closed. Richie, do you have Victoria Munga's story? All right, now let's get it ready. Now, last week, the government actually announced a reduction in the amount of money to test hotel workers to 1,000 from the 10,000, a factor that has not helped lift the confidence of hotel owners in the CBD to have the various joints open, as a balance between social distancing and profit margins still keeps the doors closed. Let's take a look at that story by Victoria Munga. Then after that, we come back and lay our heads on it.
Last month, government gave the green light to restaurants to reopen their doors for business subject to compliance to a number of strict conditions.
Restaurants that are going to open with people who have been tested.
However, things have not been rosy for restaurant owners as they seek to comply with government's strict terms of reopening. Although the government has agreed to lower the cost of COVID-19 tests to 2,000 shillings per test, conducting tests in public health facilities hasn't been easy, a situation that has forced a number of restaurant operators such as Obado to turn to the expensive options of going to private hospitals.
Based on the government directive that the price is about 1,000 shillings. The truth is we've not been able to get that 1,000 bob. We paid way more. And the test kits have not been availed to the government hospitals as is expected. So we've been forced to go to private entities to do this testing. And it's been very, very costly because, cost goes with the revenue. And in the last 2 months, we've not had any revenue. So you can imagine we are dipping into our pockets to have to do the testing.
Obado, who has been in this business for 15 years now, tells me he may have to spend at least 840,000 shillings to have his 105 employees tested, as the fate of his employees who are currently at home hangs in the balance.
The fact that they're just sitting at home is very boring. And they're also scared for their jobs, of course. They don't know whether probably we may get back to the normals that were there before. How long it's going to take, we also don't know. So some of them are also asking, are we actually going to all of us back to work, or only a few will do?
The going will get particularly tougher as social distancing measures take effect in the restaurant space, which has been operating on a takeaway basis since the outbreak of COVID-19 in the country.
Losses that we've incurred are losses that we are only taught in school. We are only told that something could happen. But we never think that something like this would happen. So yes, we have had a lot of challenges. We just woke up one day and we closed down. And it has not been easy, especially for the staff.
Obado concedes that providing takeaway catering services will be the new normal for restaurant operators. According to a report on the hospitality industry that was published by Jumia in 2017, the hospitality industry accounted for 1.1 million jobs in the country, which is approximately 9% of the total formal employment. With COVID-19 now expected to remain an endemic disease globally, the going, it appears, could get tougher in the coming months for restaurant operators and the likelihood of more job cuts imminent. Victoria Omuga for Metropole TV, Nairobi. Last month, government...
Wow, that's Victoria Omuga taking coffee. Or is it a latte? It's a sin that has not been witnessed in Kenya for the past, 2 months or so? Good. Is it the new normal that restaurant owners now have to rethink their morals?
In business, as an entrepreneur, for you to survive, you're constantly rethinking. Yes. And I'm sure this Obado and his colleagues are constantly rethinking, because the most unreliable business to set up in Nairobi today is to set up a restaurant.
Yes.
Because a restaurant comes up in Nairobi every new week or every new month. The other day was this, and before people hang on to it, it's another one.
Yes.
So they're constantly rethinking. But let me ask you this, Simba. There is some form of scandal, if I may say so. Why would someone review a figure If it's a matter of policies, figures are never reviewed.
Yes.
Registration of a company in Kenya, everyone knows, is 10,000 shillings.
Yes.
That one has never been reviewed. Yeah. So someone comes and says, for you to reopen your restaurant, we'll want you to go for this new license and everyone must get tested and the fee is 10,000. Right? Because someone somewhere had factored that research by Jumia that we have 1.1 million people. So you multiply that with 10,000 shillings, that's 10 billion shillings.
That's a lot of money.
That's a lot of money.
That's a lot of money.
So you can't tell me that a few days later you're saying, oh, we made a mistake and now we can do it at 1,000 shillings. Why the huge gap?
Is it part of cautioning, you like to say?
No, it's not even part of cautioning. Because if you're someone that you're well-meaning for your people,
yes,
then you should ask yourself, how then do we meet our people halfway? These people actually, like Obado, he's saying that he has over 100 plus people working for him.
It's going to cost
those 800,000. Yes, that is Obado. There are like 150 eatery points in Nairobi alone. So that would mean, let us do 150 times, let's put Obado to be as the baseline. So which means in Nairobi alone, we could be having over 100,000 people just within the hotel industry in Nairobi alone.
Yes.
Nairobi, CBD. I'm not talking about Nairobi Kileleshwa, Nairobi Muthaiga. I'm saying Nairobi alone. So why would someone come up with a very arbitrary figure that we are going to test people at 10,000 shillings, right? I'm telling you, the people that are working for government, some of these people are corrupt to the core. So someone knew that if we people need to move on, right? What happened to supermarkets? Have they ever been tested? You go to a supermarket, someone cooks for you. Do they get testing? So why the double standards, if you ask me? Today, go to Naivas, and I'm sorry for dropping names, yes?
Yes.
Go to any supermarket, they have like a point whereby someone cooks. That gentleman, that lady who does that, did they get tested? The person who serves you milk, right? Do they get tested? Or we want to hope that the organizations they work for is actually proactive and is testing them. So there are a lot of double standards. There are a lot of inconsistencies when it comes to actually this entire figure, because the challenge with the African governance and African social setup is that we are corrupt people. Someone sat somewhere and thought, if we bring back hotels, we're going to get 10 billion shillings. And this money, let me tell you, you want to test these people. Camry itself tells you that we are not resourced. So what are we testing these people with? JIC? What are we testing them with? Camry itself tells you that you guys, we are lacking capacity. The medical practitioner saying, you want us to test hoteliers. Yes, us ourselves, we are not tested. You know, that's an irony. You know, that's like taking your sheep to the care of a lion. That, oh, lion, I know now it's hard time and everyone is starving. Please don't eat my sheep. It's reversed, and someone needs to, I don't know. It's the entire system that is rot. From the top, all the way, everyone is rotten.
I wish we had more time. Guess what? There's a survey that was conducted by Tifa Research that now indicates that the governments therefore have to do more if you go and look at exactly what most Kenyans are foregoing. Remember, number one on that, or let me just tell you the top 5, it's about rent. Number 2 is about the amount of money that we're spending on our clothing, and also helping our relatives. So the question that we're going to ask Ogwang Omuga next week, and I hope you will be there, is that if you look at the money that we're discussing right now, there's a 1,000 a week, therefore, to the most vulnerable in the community. Is that enough vis-a-vis what most Kenyans are foregoing right now. And remember, 96% of Kenyans are saying that their ability in terms of the way in which they live their lives, I'm talking about the economic ability, has been reduced. That next week with Ogwang Omuga, but taking back to YouTube, that is at Metropole TVKE, and through text message 2146. Once we come back, Stephanie Wanswa is going to tell you exactly how you are supposed to practice from your house, since most gymnasiums are not yet open. Once we come back.